This comment says, crazy to me that you'd take an aggression case without the animals having a clean bill of health from the vet. And then there's this emoji. Step number 1 is to rule out medical cause for the extreme behavior. So I want to use this comment to talk a bit about some of the nuances of pain and behavior and what that looks like practically in a behavior case. So 2 quick things up front, and we have done deeper dives into both of these topics because we do talk about the intersection of pain and behavior at length on this page. And that is because I specialize in aggressive behavior and nervous system dysregulation, and studies show that up to 80% of cases involving aggressive behavior involve underlying health issues. And so this is a huge part of my work. We do not rule out pain or health issues in dogs. And I think this is a common point of misunderstanding, is that people think, well, I take my dog to the vet annually, we get annual blood work, they have a physical exam, therefore if there were health concerns tied up in my behavior concerns, the vet would have found them. And unfortunately, that is not how that works. It is often a much lengthier, ongoing process. Often behavior problems are the first signs of pain, or not even behavior problems, but shifts in behavior. And in a lot of my clients, often this pain has been going on for a long, long time. And we can see significant amounts of pain before it shows on a physical exam, before it shows on imaging. Statistically, we're likely looking for orthopedic issues, GI issues, or allergies are another really big one that I see. So as nice as it would be to be able to just go to the vet, have a quick exam, do some routine blood work, and find nothing, and then call it a day and say, okay, it's not pain, it must be behavioral. Unfortunately, that's just not how anything works. The other thing I want to quickly address is the idea that we would only be looking for pain or medical causes in extreme cases. This is definitely not true. I want to be considering pain and health concerns in the most mild of cases. Again, sometimes the behaviors aren't even behaviors that are going to prompt someone to reach out to a behavior consultant. So it is definitely not just for extreme cases, or even just for cases involving aggressive behavior. Now I'm going to talk a little bit about what the process might look like practically, at least what it looks like for my clients or my potential clients. And then I'll talk a bit about where I think sometimes there's a bit of confusion around the process. So I am assuming underlying pain and health issues in all of my cases, because again, statistically, 80% of these cases have underlying health issues that ethically we should absolutely be investigating from the start. And 80% is close enough to 100 that it is something that I am concerned about in all of the cases that come into my inbox. But I can't just say to the client, go to the vet and rule out pain, because that gives the client and the vet no direction. And sure, we might start with a physical exam and blood work. And again, they have likely been in the last year if they are seeking out support from a behavior consultant, unless they have behavior concerns that have precluded them from regular vet care, which is certainly a thing. But those dogs obviously still cannot just go get a quick vet check. And if I do that, my clients then might have the misconception that pain has been ruled out. It is off the table. And that is unethical of me and a disservice to the dog, and a disservice to the human who's looking to support their dog. I need a ton more information first. And I get that information in my new client questionnaire, and everyone might do this a little bit differently. But my first step before someone even books a consultation is my new client questionnaire, and I get a ton of information in there. And because I specialize in aggression and nervous system dysregulation, I am really good at picking up on patterns of different kinds of health issues. I am not a veterinarian, and I am very careful to stay in my lane. But I am able to gather more information that can help the client and the veterinarian take a more focused look at their dog's health and where problems might lie based on the behavioral symptoms that I find out about first through the new client questionnaire. And these questions are all encompassing. So they're not just about the presenting problem behaviors, right? The concern of the human. And we talk about this a lot through the lens of holistic stress reduction. We need to be looking at the entire picture of what's going on with the dog, because the most stressful thing for the dog may not be the most stressful thing for the human. And the dog's experience is really important here. And so this is this holistic look, and within there, I'm also digging for information, common behavior changes or patterns of behavior that we might see in dogs who are experiencing underlying pain. And this is everything from specific behaviors like opting to lie on the hardwood instead of their beds, or things like licking, yawning, hyperarousal, certain handling concerns, sound sensitivity, hyperattachment. These are all behaviors that are highly comorbid with pain and health issues. But it's also looking at things like the timeline. Does the dog's behavior tend to get increasingly intense and then drop off a bit? And then, so there's kind of this up and down. There's difficulty finding some of these patterns. Did the behavior start suddenly, escalate suddenly, change suddenly? So there are a lot of different pieces of information that I'm gathering so that I can support the client and the veterinarian in being mindful about their time and resources and stress on the dog, so that we're taking more targeted looks. I'm not suggesting specific diagnostics. I'm not suggesting specific medical issues that I think might be at play. That is not my lane. But I might say things like, I recommend that we get a gait analysis. Or let's talk with your vet about this list of symptoms, because these could point to a GI issue. Often I am helping the client do that, at least at first, just based off of my questionnaire before we even meet for our virtual consultation. And that's just the way that I have my business structured. So we do the new client questionnaire, the client purchases their new consultation package, new client consultation package. They schedule what's called our first touch appointment, which is our 2-hour Zoom. And after they have scheduled their appointment, I create a personalized management and enrichment protocol. And the management and enrichment protocol is the entire first phase of behavior therapy. And when we talk about enrichment, we are also talking about physical health. So a lot of times we think about enrichment as like physical exercise and puzzle games. But it actually includes things like sleep hygiene, physical health and veterinary care, all of these different nuances to well-being. Agency is a big one. And the purpose of management, the reason it's our first phase of behavior therapy, is because this is going to get everyone safer. It's going to increase well-being. It's going to reduce stress. And we don't want to wait through a lengthy process of investigating what potential health issues may be going on with the dog to get those things into place. So investigating medical issues, again, we cannot rule them out. Investigating them is absolutely within that first bundle of things, but that doesn't mean that we don't also want to give the dog outlets for stress and implement safety measures within the home, for example. And so often in my management and enrichment protocols, I'm including resources on pain, and I'm including resources on pain that are specific to the case in front of me. And I'm making suggestions based on the data that I have. And then in our consultation, I gather additional data. And sometimes before our consultation, based on the management enrichment protocol, we're able to do things like start pain trials, for example, or make appointments with specialists, or set up things like digitherm scans or gait analysis. And then we go from there. And so, for example, in the cases that were in the video that this comment was left on, health was absolutely one of the first things that we delved into. And it was not something that we had ruled out or walked away from. Actually, I believe in at least one of the cases, we were actively addressing health concerns. But the thing is, pain and behavior are not separate things. They are intertwined. And so while you may have some cases where the dog has no concerning behavior history or history of dysregulation, and then they get an ear infection and you touch their ear and then they bite you at a low level and then you fix the ear infection and then they don't bite anymore, the vast majority of these cases are being indirectly impacted by pain. And so the dog, even if pain has been a long-standing part of their behavior history, we find out, The pain is doing things like lowering tolerance to stress, decreasing resilience, increasing pessimism. In most cases, the dog still needs behavior therapy support. And so this is something that is intertwined, both theoretically and practically. I hope this is helpful.